we are all so glad you could be here today to hear directly from Magee moms and patients about our personal healthcare experiences and why we strongly support the Magee Nurses advocacy for research-based national staffing standards. I'm Teresa Brown. Each of us is here to share a deeply personal story about our own healthcare experiences at Magee and why supporting our nurses matters so much. So here's my story. I'm a Magee breast cancer patient, and I remember a day when I showed up to the infusion center for an injection. The injection had a complicated pre-authorization process and some serious side effects, so I was already anxious in the way one is when I got there. But adding to my anxiety was how harried the nurses were. And I could tell they wanted to provide good care, but they were completely overworked in a broken system. So the nurse preparing me for the injection didn't have all the information that she needed to actually give it to me. Another nurse said that a doctor hadn't yet signed the order, and so they weren't even sure if I could get the shot that day. And people should think, when you're already stretched to your limit and then suddenly some step hasn't been done that you need another person to do, that's just time you don't have. And I also heard two other staff members, I have good hearing, commiserating about having more work to do than they could possibly finish, and that was what every day was like for them. So in addition to being a cancer survivor, almost 10 years, I'm also a nurse, and I'm a New York Times bestselling author on nursing and healthcare. But because I've worked the front lines of care, I recognize these nurses as nurses with good hearts and good intentions, but they were working past capacity. And they've been expected to do that day after day, year after year, without relief from feeling stretched to their absolute breaking point on the job. That is what I saw, and I know what that feels like. So that's why I'm here today with other Magee patients supporting our nurses. Magee nurses courageously voted to form a union and are now advocating for all of us by negotiating their first contract with UPMC. To help shape their proposals, they sponsored a groundbreaking community survey that over 1,000 people filled out. I was one of those people. In the survey, it was clear that patients want more time with nurses, and nurses want to spend more time with us. Magee nurses used that survey feedback to promote national staffing standards to UPMC. Standards that dozens of clinical studies prove are essential for patient safety and quality of care. And I know this literature very well. It has been proved over and over again in the US and internationally that when nurses are overworked, patients actually die who would not have died otherwise. So this is very serious. This is not trivial. This is not about, I want my day to be easier. It matters. Some of the standards they proposed include 1 nurse for every 4 oncology patients, 1 dedicated nurse for every woman in active labor, and 1 nurse for every critically ill newborn. The nurses really deserve our thanks for creating a unique opportunity for patient and community input. And we are here today speaking on behalf of those Magee moms and patients because we need change. Magee nurses presented their staffing proposals in March, but UPMC has not answered. What is it? Oh, it's July. Yeah. As a patient, I find it deeply concerning that the administration of the premier birthing hospital in our region and the most profitable hospital in our state hasn't respected its nurses enough to respond to them. The Pittsburgh community, however, supports the nurses' proposals. Magee nurses have been by our side in our most vulnerable moments, And now we stand by their side. It is past time for UPMC to respond to the Magee nurses' proposals to negotiate a contract with standards for safing and nurse retention. It's West Penn Hospital and Allegheny General Hospital have both done it. It is UPMC's responsibility to do the same. Pregnant women, babies, people battling cancer, and all the other patients in our region deserve better. UPMC, it's time to truly fulfill the promise of life-changing medicine. So I'm now going to introduce Magee mom with her children to actually prove she is a mother. She's Isabel Chaika.
All right. Okay. I'm going to hear smacking. Sorry. Okay. My name is Isabel Chaika, and I'm here with my son. He is going to be 4 years old in the fall. This is the light of my life. And he was delivered at UPMC Magee after an unexpected transfer, medically necessary and unexpected transfer. I spent the 3 days after becoming a first-time mom researching nursing programs because what I experienced with my nurses and midwives was extraordinary. I truly thought there was no work as important as the life-sustaining work of labor and delivery and nurses in general, and I do still think that, but the postpartum fog cleared and I know that I don't have what it takes. Fair enough. My parents were both nurses, and the world's need nurses at every hour of the day, be it holidays or evenings or weekends, school events, whenever, it's always. It is also highly skilled, incredibly physical, and emotionally connecting with your patient is at the forefront of excellent patient care. Nursing is a truly demanding profession. I did well in my transfer because I had a team of nurses and midwives, one in particular, that hit the ground running and made me feel like I'd been a patient at Magee the whole time. They made me feel without a doubt that everything was going to be okay. And as a first-time mother experiencing an unexpected medical transfer, I needed that. Do you like the crunching ASMR? Okay. It was okay. I don't actually know where I ended, but as a first-time mother, okay. It was okay, and that's because of the amazing care I received, medically, physically, and emotionally. Even with all that, the background hum at Magee is that there are too many patients for the staff to safely cover, and nurses are running from one room to another. In Pittsburgh, UPMC Magee has a reputation for being a baby factory due to the high number of patients it sees. The midwife who delivered my baby had an entirely bloodshot right eye, just totally bright, livid red, from the strain of long hours and high patient load. For a person in labor to take note of that, the strain must be pretty striking. Labor and delivery are some of the most vulnerable hours of someone's life. These strangers weren't strangers though, even though I just met them. They were nurses. They had my back, and they had my husband's back, and my son and I are okay because of them. Now as a mom and a person living in 2026, I do a lot of kitchen table math to make the bills work. I also keep a pretty rowdy preschooler mostly in line and have a decent nonsense detector. So when a company that makes a profit of over $400 million and compensates its nonprofit CEO to a luxurious tune of $13+ million, but won't come to the bargaining table for the nurses and patients who make them that money, that feels very exploitive. UPMC could agree to safer staffing standards today. Instead, they have been ignoring these staffing proposals for 4 months at the expense of patient care to moms like me and babies exactly like my son. Patients want and need evidence-based birthing standards throughout Pittsburgh. We want to know that we have one-to-one care when being induced or in active labor. This is necessary to catch any sudden changes in our medical status and to avoid unnecessary complications, and to ensure we are empowered in the decision-making for our births. We want to know that the most fragile babies have one-to-one care in the neonatal intensive care unit. That is critical for providing the type of care that supports healthy development for the rest of their lives. I had my first child at Magee with excellent care from nurses, and I hope to have my second here too. The difference, I hope, is that the nurses are treated with the same respect and dignity they give to their patients, And for that, UPMC needs to bargain with the nurses union about safe staffing standards now.
Thank you, Isabel, for sharing your story. Very powerful words. Next up, we have a Magee mom and local physician, Dr. Natalie Gentili.
May I borrow this?
Please do.
Thank you. Hey, everybody. Oh, my God. That's powerful. I'm Natalie Gentili. I'm a local family medicine physician here in Pittsburgh. I am the daughter of a nurse. I own a private practice in Shadyside, and I am not a Magee nurse, but a Magee nurse was present when I was born. A Magee nurse sat with me at the nurses station when my dad, a longtime OBGYN at Magee, would bring me in when he would round on the weekends. And I would sit there and hang out with the nurses. I don't know why I forgot about this earlier, but a Magee nurse was with me as a young cancer patient of ovarian cancer when I was 18. A Magee nurse was there when I rounded as a Pitt medical student, showed me the ropes, kept me in line. And a Magee nurse was there when I delivered my daughter 7 years ago yesterday, and it was amazing. I've referred patients to Magee for prenatal care, delivery, and newborn care, and I have built my career around the same things that these nurses have, which is making sure the patients get the time and attention that they need to be safe. And that's why I'm here today, in support of the Magee nurses and advanced practitioners and their proposal for evidence-based national staffing standards. In my own practice, I see what happens on the other side of that rushed system. So patients who come in after delivery unsure of what they were told, what to watch for, what's normal, what's not. Follow-up that falls through the cracks, not because anyone failed to care, but because there simply wasn't enough time. I remember when I was in labor with my daughter Layla, and our nurse, who was wonderful, said that she was sorry she couldn't be in more, but there was a mom being put on ECMO down the hall. And I was thinking, this is terrifying. This is terrifying. You're all working so hard in these high-stress situations and can't sit one-to-one with your patients because of this. And I want to be clear, this isn't about blaming nurses. It's quite the opposite. The nurses I know are working as hard as they possibly can. The problem is they are being asked to do too much for too many patients at once. What Magee nurses are asking for isn't radical. It's the same standards set by the Association of Women's Health, Obstetric, and Neonatal Nurses, standards that are the product of clinical research, including a recent comprehensive study of Penn nursing, showing that staffing ratios directly prevent complications, prevent deaths, and prevent the kind of burnout that pushes experienced nurses out of the profession entirely. Standards that already exist in the nurses union contract at West Penn, down the street. And the need is real and it is local. Severe maternal mortality in Allegheny County has risen 55% in the last 10 years. Our infant mortality and preterm birth rates are worse than the state average. Black mothers and infants in this county face more than double the risk of their white counterparts. This is our neighbors we are talking about. That's how acute this is. And what makes this especially hard to accept is that this is not due to a lack of resources. Okay, Magee was the most profitable acute care hospital in the entire state last fiscal year. But Magee nurses have been waiting for more than 4 months, as we've heard, for UPMC to even respond to their staffing proposal, and I know they know how to respond. As a physician, I know what it looks like when resources don't reach the bedside. And there is not much more demoralizing than working in a system that treats you like a disposable cog. This isn't just about one hospital. Pennsylvania is short 20,000 nurses, the worst shortage in the country. It's embarrassing for this state. Every time a hospital fails to staff safely, it doesn't just hurt that unit. It strains the entire healthcare system that all of us, nurses, physicians, patients, depend on. So today, as a physician who sends patients to Magee, who cares deeply about this region's health as a Pittsburgher, as someone who grew up in that hospital since birth, I am asking UPMC, negotiate fairly, invest in the standards that keep parents and babies safe. Our community's health and the community that pays into and works within the walls of that UPMC system depends on it. Thank you.
That was so great. I just want to make clear also the so-called staffing shortage is actually not a shortage of actual nurses. It's a shortage of jobs that nurses are willing to do. It's a very important distinction. There's lots of lots of nurses in the U.S. right now who are not working as nurses. And that really tells you
That tells
something.
us a lot.
Yeah. So thank you again. That was very powerful. We have another Magee mom now, Courtney Zaghetti, with her very cute daughter.
Hi, my name is Courtney Zaghetti. This is my daughter Inez. She was born at Magee almost 3 years ago. I'm a Magee mom. You are Inez Zaghetti. Yes. I'm a Magee mom. I'm also a audiologist. I'm a former UPMC audiologist, current stay-at-home mom. But I was employed while I gave birth to both my girls, which I feel like gave me some perspective going into giving birth. I strongly support the nurses' proposals for national staffing standards and retention of experienced nurses, and this is why. Much like Isabel, the first time I gave birth, I was actually intending to give birth at the midwife center and transferred during labor due to medical reasons that were necessary. That birth ended up resulting in a C-section, so when it came time to give birth to my second daughter, Isla, I required a higher level of care and continuous monitoring because I was attempting a VBAC. I had an amazing nurse who was with me almost every step of the way, or as really as much as she could, and I truly could tell that. As someone that previously worked there, I was aware of the staffing issues. We were experiencing it within our department as well. So I was cognizant of that in terms of realizing how busy she really was. Even though she was busy, she advocated for me along the way by calling the doctor back multiple times when I continued having symptoms related to low blood pressure following my epidural. She persisted even after it seemed that the anesthesiologist had done all that they thought was needed because I was still not feeling well. And I remember that was kind of a stressful situation because I think she was also very busy with other patients, and I kept experiencing symptoms that did not seem to be taken as seriously as how I felt they needed to be. But her advocacy did lead to a significant reduction in my symptoms prior to pushing, and I ended up having a successful VBAC, and it was honestly a very redemptive experience for me, and I credit a lot of that to my nurse and her advocacy and empowering me through the process, because there were definitely moments I was scared. I also had a midwife for both of my births who was present for both of them, who was amazing as well. However, it was clear during both of my births that the nurses were overworked largely due to understaffing. Throughout my labor and postpartum stay, there were multiple moments I would need something or someone I had never met would come in and help because my nurse was busy with another patient. The most obvious example I can think of when I think about this is I had monitoring that was happening, continuous fetal monitoring, and it wouldn't stay on the baby's heart rate or heartbeat, and at one point this nurse came frantically running in. I'd never met her. She seemed terrified, and it terrified me because at that moment I was like, this had been happening this whole time. It kept coming off. I kept moving it because I was alone, and it was just my husband and I. So she came running in and she was like, oh my gosh, and like freaking out. And I remember it really raised the tension of the room just because I was like, I never have met you. You seem really scared. I'm like, should I be scared? And it ended up all working out, and my nurse was able to come and check on me as well as my midwife, and everything was okay. But it was definitely a glaring example of kind of what's happening, I think, like behind the nurse's desk in those situations when you're the patient in the room. You don't always see it, but you can kind of just tell by the energy that is happening around you. This lack of continuum of care at such a vulnerable time as an active labor is unacceptable. We were talking a lot about the one-to-one staffing ratios that are recommended when you are in active labor. UPMC must do better by their patients, nurses, and our community. This starts with responding to the Magee nurses staffing proposals now. Thank you, everybody.
Well, congratulations on your successful VBAC.
Thank you.
But also thank you for sharing your compassion and empathy for the nurses.
Yeah, they were amazing.
So next I'd like to welcome Allegheny County Council Member and Magee dad, Dan Grisbeck, to come up from the audience. And before you start, I want to say that as a Magee patient, all of us Magee patients are so appreciative that you are here speaking on behalf of the Magee nurses. Thank you.
Thank you very much. As she said, my name's Dan Grisbeck. I have the honor of representing much of the South Hills on Allegheny County Council, and just recently we passed a resolution unanimously in support of safe staffing ratios for Magee nurses. But before I read some of that, I just want to talk a little bit about my experience at Magee. So I am the husband of a former medical ICU nurse and a current nurse anesthetist. And as you mentioned, I am a very proud Magee dad. 8 months ago, roughly, we went to Magee to the ER for lack of fetal movement. My wife hadn't felt our son for going on roughly a day, and when we were rushed in, we got hooked up, and yeah, we went through our tests, and we think you're supposed to score, I forget what the test is called, roughly a 5 out of 8. I think we got a 1. And so immediately we were rushed into an emergency section, and thankfully everything went fantastic. My son came out screaming, it was wonderful, right? But during the scariest day of my life and my wife's life, what I remember most is just how phenomenal the nurses at Magee were. They helped us through every part of that process and every part of the 2 weeks after while my son was in the NICU. But one of the things that I starkly remember was, for those of you who haven't been in the NICU at Magee, which I imagine is probably very few of you, but it's wide open, right? And you can see everything around. You can see all the other newborns, all the other parents and caregivers, all the nurses and the doctors, and it was amazing to me how many other families our nurse had to care for at the same time as our son was still acutely sick, right? Still on bubble CPAP, routinely satting, low 90s to high 80s, routinely requiring rather emergent care. And many of the infants, many of the babies in the ICU were significantly sicker than him, right? And that is just a standard that I think is unforgivable, right? We can do better. We should do better, and it's not like it's something that's unique to Magee, right? Like I said, my wife was a MICU nurse previously at Presby. She went through the throngs of COVID. It's not a unique experience, and we have the resources to do better. So I'm going to read a little bit of the resolution we passed on council, encouraging UPMC to take those steps. Bill number 13998, TAC 26, a resolution of the County of Allegheny, Commonwealth of Pennsylvania, supporting Magee-Womens Hospital registered nurses and advanced practitioners who are advocating for national staffing standards and urging UPMC to work collaboratively with them to negotiate a fair union contract. Whereas Magee-Womens Hospital holds a unique place in our region, for generations, families across Allegheny County have relied on the expertise and compassion of Magee's caregivers to bring new life into the world and to provide specialized care during some of life's most vulnerable moments. And whereas the nurses and advanced practitioners at Magee are the backbone of this institution, their dedication is the reason UPMC Magee maintains its reputation as a world-class center for women's health. And whereas Magee nurses have expressed they are struggling with a lack of time with their patients, turnover, burnout, a loss of experienced nurses, and inadequate professional benefits such as paid parental leave, and whereas to address this crisis, Magee nurses formed their union and entered into contract negotiations with UPMC in order to advocate on behalf of their patients and community. And whereas nurses have proposed a range of urgent solutions, including evidence-based national staffing standards and policies to retain nurses. And whereas other employers, such as West Penn and Allegheny General Hospital, have responsibly negotiated union contracts with their nurses that include national staffing standards. And whereas nurses began their negotiations in January and presented their full contract proposals to UPMC on April 30th, but UPMC has not responded in a timely manner to their staffing standards or other major proposals. And whereas the Pennsylvania Healthcare Cost Containment Council released a recent report showing that Magee was the most profitable out of all 152 general acute care hospitals in the state, with $437.5 million in operating profit last fiscal year. And whereas UPMC is the largest health system and private employer in our county and our Commonwealth, and has both the resources and responsibility to lead on investing in nurse staffing and retention, and whereas patient volume is increasing at Magee as the summer months bring a higher number of births, and whereas Magee must have labor peace to ensure the continued provision of essential care in our county, the Council of the County of Allegheny hereby resolves as follows. The county's ability to continue a collaborative relationship with UPMC depends on the system's commitment to being a fair and responsible employer and healthcare provider. Given that maintaining labor peace and a strong, respected nursing workforce is necessary for the future of Magee-Womens Hospital and our community at large, Allegheny County Council hereby urges UPMC to work collaboratively with nurses and advanced practitioners to negotiate a fair contract in an expeditious manner for the health of women, children, and all patients throughout the region.
Thank you so much, Councilmember, and everyone should, I want to reemphasize that it was a unanimous vote among the county council to support this proposal, so we really appreciate that. Okay, because UPMC is not listening to nurses, Magee patients have a formal request that we would like to attend an upcoming negotiation session. Dozens of Magee moms and patients have signed onto an open letter to UPMC, and I'm going to read an excerpt from that letter. Dear UPMC Magee-Womens Hospital President, Dr. Richard Magee, sorry if I got that wrong, okay, and the Board of Directors. We are deeply invested in seeing Magee continue to fulfill its mission of being a regional and national leader in women's and infants' health care, I think these are their words, for current patients and future generations. It is in that spirit that we are formally requesting that a group of patients join one of your negotiating sessions so that we can share our care experiences at Magee and explain why we support nurses' proposals for evidence-based national staffing standards. As patients at Magee, we of course faced challenges, incredible fear, anxiety, worry, emotional distress, and physical pain. But what made the experience bearable, and we have heard that today, was the frontline nurses and the advanced practitioners who were there by the bedside every step of the way. They were focused not just on the delivery of hands-on care, but also on educating us, listening, providing moral support, and empowering us to participate in our own births and healthcare decisions. They consistently brought a sense of calm competence into the room, even when they were expected to be two places at once. And their compassion, and their compassion shined through from the core of their being. It was also clear to so many of us that, although the nurses went above and beyond and never complained, they were often rushed and faced pressure on the amount of time they could spend with each one of us. We urgently want UPMC Magee to work with your nurses to implement evidence-based birthing and staffing standards. And now I'd like to welcome from the audience our last, but certainly not least speaker, longtime Magee nurse, Ashley Grieco.
Good afternoon. My name, as she said, is Ashley Grieco. I'm a nurse in the neonatal intensive care unit at UPMC Magee-Womens Hospital. Thank you all for being here today. I especially want to thank our patients, their families, and the community members who have joined us today. We do this work day in and day out, and we formed our union for you. I am proud to stand here today as a nurse and as someone who believes every patient deserves high quality, safe care. From the very beginning of forming our union, nurses have been negotiating on behalf of our patients and everyone in our region. This has never been about us. It's been making sure hospitals are safely staffed, nurses have the resources we need, and every patient receives the care they deserve. That is why it was so important for us to gather input directly from you all, the people that we care for. And we were blown away by over the 1,000 responses. Every day, we see firsthand how staffing, support, and working conditions directly affect patient care and patient outcomes. When nurses, patients, and our community have a strong voice, our healthcare system as a whole benefits. Magee nurses will be backing up your request and formally asking UPMC to invite patients to join one of our negotiating sessions. We believe the people most affected by these decisions deserve the opportunity to be heard. UPMC has heard from us, and now they need to hear from you. Your voices matter, your experiences matter, and together we can advocate for the kind of healthcare that this community deserves. Thank you for standing with us.